Welcome to HICGI News Agency.
HICGI News Agency Live. Welcome agency, HICGI News Agency.
This is HICGI News Agency.
This is HICGI News Agency.
News Agency live.
We are live, HICGI News Agency. This is HICGI News Agency. Welcome to the Senior Citizens Talk of HICGI News Agency. My name is Chivumbi Ernest Benjamin with an honorary doctorate in humanities by the Canadian universities. And we are proud tonight. We are joined with a senior specialist and in the medical world. And there is some specialty that he handles, especially in bones. We are going to tackle more of several issues concerning muscles, bones, joints, and to learn about our physical health. We are with Dr. Mutebi Isaac Lukanga. Welcome all our viewers from Alaska to Russia to Georgia, Brazil, South America, and all back here in East Africa, Kampala, Uganda, in the heart of the capital. Doctor, welcome to the Senior Citizens Talk.
Welcome.
Doctor, would like to know, who are you basically?
I'm Isaac Mutebi Lukanga, the senior orthopedic technologist in Uganda, the first orthotist in Uganda.
The first in Uganda?
Yes.
Oh my God.
Trained in the Dar es Salaam University at that course. Yes.
When you talk about you being the first specialist, they call them orthopedics? Is that
You know, in orthopedics there are categories. In the discipline of technology, you can find orthotists, you can find orthotics, prosthetics, then you can have orthopedic masters. So this, in my category, I combine all.
You combine all?
Yes. Orthotics and prosthetics.
So for those who think that these are terms, like how the born again pray, could you try to break down that who are these specialists? What do they do?
The specialty differs. Now, when you look at a human being, human being has soft tissue and has a hard tissue.
Okay.
Then you have same hard tissues, the ligaments, tendons, and then the fascia. So our specialty is actually dealing with the bones, joints, and the ligaments.
Okay. So if I have cases, I have maybe back pain, I have an injury, I have I've gotten an accident, I've run down a joint issue, how do you begin, or how do you address those concerns?
Now, some of these conditions or disorders, they depend. It could be congenital, it could be degenerative, it could be traumatic.
What do you mean by those are medical terminologies?
You can get injured. For example, having an accident, then
Yes.
you have a traumatic accident, a traumatic injury. Then you can be born with, or you can get bone infection. So that's where we categorize them. Is it infection? Is it traumatic? Or it is degenerative. There is what we call wear and tear. You can find that you have now gone down and you are taller than your father or your mother. Yet before, it's the mother who was telling you, my friend, hurry up.
What causes that?
Wear and tear.
You mean, we had the band called Ofono when I was young, and they even made a big soda from Ofono. Ofono was growing up at a very fast rate, and I think he became one of the tallest people either in the world or in Africa. So how can we describe that?
Some of them are genetic, and these are carried on within the family, and they are usually abnormalities.
Abnormalities.
Yeah, because at the end of the day, they will come with the orthopedic disorders. Either the trunk is too the spine is too long, either the lower extremities are too long, and these growth disorders, congenital disorders. Some of these conditions are born with, and they are hereditary. Some of them are congenital, some of them are hereditary. Others are traumatic, others are degenerative, others are infection.
Can we
Bone
begin
infection.
with those or infections maybe, so we can be able to learn how people get infected?
Okay. You will find that in if you look at your skin, being the largest organ in the entire body,
Okay.
there's a lot of microorganisms which are on the skin. If you get a prick, it can find its way into the periosteum, into the bone, you get infected. You find some tiny microorganisms like a streptococcus, like Brucella, like there are several of them which can affect the bone. It destroys the skin, then destroys the muscle, gets down, then goes on the periosteum of the bone, and then it infects the bone. If you look at the bone, actually there are nutriments where the bone receives blood supply, that fuels communication, that fuels other nutrients to feed the bone. Then once an infection has affected the bone, it will start to decay. It will start to get destroyed layer by layer, layer by layer. And if it is the prococco, you'll find that it has affected the bone, and then eventually the cortex of the whole bone is destroyed.
So in what circumstances or environment are we prone to those infections? Are there viruses that can, maybe I go to the forest or bush, so they get me? What exactly happens?
I would say in our ways, if you look at the pseudomonas, if you look at those microorganisms, they are within, we are with them.
Oh.
Yes. Flies transport them,
Okay.
fleas transport them, and then animals. They are good. They are good. They are good at animals to hide in the animals, and for them they don't get sick. But once you get it, you become sick. So those can also affect the bones. And if somebody gets a piercing nail or penetrating wound, and somebody just smears something, said to get better, and then the microorganisms can find their way and destroy the tissue. Then eventually they go and destroy the feeding layer of the bone, which we call the periosteum, and eventually you get the infection. You see pus coming out. There are different colors, green, red, and so the doctors can take culture and sensitivity and they say the bacteria which is here is this name.
My God.
And then you will start treating you. But for you, when you are somewhere in a village, you just say, there's a wound here, then you can bring bandos in, and then you can get a capsule, open out, and then pour there. And then this microorganism find very good food. They feed on it, and then you find the next day the whole area is affected.
It looks like when you explain you have a special relationship with the dermatologists, because when it comes from the skin, but at the end of the day it's going to affect the bones. Maybe the one with the skin can stop it, or
yeah, the skin is the protective layer of the body. Being the largest organ of the body, it protects the body. But once they overrun it, they overrun the dermatological, the skin, it will get down to the periosteum. The microorganism will get down to the periosteum, causing it to produce pus. Then it will go to the nutriment layers of the bone, and then the bone is infected. It's only the doctors who can smear, who can take off blood or pass. Then they say the type of microorganism here is sensitive to this, is resistant to this. But for you, just say, hey, capsule, get me that capsule, which is, then you start to take. Kumbe, you are taking something which doesn't treat that microorganism, which is within that pass.
Okay, so apart from those infections, do we also classify diseases on the bones or?
They are bone diseases. They are tumors.
For more than 10 years, Keb International Group has been your number one partner in tours and travel consultancy. We also do real estate, legal services, ICT services, and much more. Find us on kebinternationalgroup.com or write to us at info@kebinternationalgroup.com. You may also write to us at PO Box 35827 Kampala, Uganda, or visit us on Namaswa Hill off Entebbe Highway. Call us on +256 200937566 or +256 3948632 or 46, or you can send us plus on WhatsApp on +256 752 1375 66. Cab International Group, your number one rail business partner.
The cancerous, malignant, and then malignancies can evolve, can be benign, can be cancerous, treatable and non-treatable. The bones also get sick, but you find that somebody cannot know whether this infection is cancerous or it is not, or treatable or non-treatable. There are several tumors which can invade the bone. It's only the doctors who will always tell you this one is cancerous, this one is malignant, or this one is benign. Then you can start. And the drug of choice is there. But for you, just take whatever is on you. Say, hey, there's pus here. Hey, give me an injection. It comes to you when it is too late. It has already embedded your bone. The calcium is destroyed. And then the cortex of the bone is chewed out. But it's only the doctors who can always tell you this is the type of microorganism which has embedded this bone after doing the culture and sensitivity. And it's sensitive to this, or it is resistant to this. Gram positive or gram negative.
Leprosy, is it also a bone disease or a skin disease?
No, it's a skin disease. And actually, one good thing with leprosy, I've liked it, it only destroys the anterior horn cell. I mean, it only destroys it is not like it's not like you look at polio. Polio, the virus destroys the anterior horn cells of the nervous system. And the polio patient, when you prick him, you pinch him, he will say, hey, it's painful.
Yes.
While a leper patient will not feel, even if he puts the leg in the fireplace, they'll say, who is roasting meat? Because we had it somewhere. Their legs were burning, but they were saying, who is roasting meat?
They can't feel
because
anything.
The sensory system has been destroyed. Although the motor remains there, it can pull away, but he can't feel. Likewise, the polio patient will always have his anterior horn cells destroyed, which means the nerves, the muscles will become atrophic, atrophy. And then the sensory remains intact. That's the difference between polio and leprosy.
If you can remind me, is polio the same as being lame, or it is a different thing?
What it does, once the motor system is destroyed, of course, you start to, they either don't grow or they don't expand, and one leg will become, one extremity, one limb will become smaller and smaller because the function of the muscles is not there.
And being crippled is what?
Yes, you get crippled. Even in rape patients, they can get contractures because they don't feel, and the muscles are being chewed out. Where in polio, the sensory system is left intact, but the motor system is affected. Therefore, the muscles will die out, they will disappear. If you have seen weightlifters, every day they build, and the muscles become bigger and bigger and bigger.
Exactly.
But since this system has been destroyed in polio, they die out. But if one prickles you, you definitely feel that there's pain, my friend. Don't pierce me. Yes. Yeah. But he cannot move the limb because the motor system is destroyed. Yeah.
When people are aging up, so many complications of bones happen to them.
Yes.
Could you please take us through, because there's so many senior citizens who are watching and are eager,
yes.
they're the ones complaining more.
Yes. The bones depend on the movement of the muscles, that the nutrient canals in the bone are being fed. They are fed continuity, supply of blood supply. But when you get to a certain age, so the activities that you are doing, they start to get limited. You can't even move to the neighbor. So you get the joints unclosing. You get unclosing spondylosis, and then you get the joints locked up. Then there's wear and tear. Then you develop a gibbous, you develop a scoliosis because the muscles on the waist have been destroyed. So that's what happens. And then you get at in old age, which I usually fear, but I am already old. It's the atrophy of muscles. Yes. Because the muscles depend on activities that you do, movement. But now the movements are limited. So if it is the intercostal muscles in the ribs, they start to become closer and closer, and the oscillation of the heart gets tiny movement. And then you just move from here to the next. They say, hey, Muninde cow, wait for me. You can't climb the hills you used to climb because the oscillation areas has diminished. Call it atrophy.
So if it is it possible to avoid such a situation maybe when you're still young, or it is automatic when you age up you have to face those things?
Maybe you have seen some whites climbing the mountains, climbing the hills. Depends. They depend on our expansion and contraction. But when you sit, as I told you, if you have your hand bent here, the muscles of the anterior will atrophy, and this will become lengthy. Then you can't pull it any longer because the pulling group is longer, but these ones are atrophic. They have shrunk out, and then you develop. You need a walking. You need a walking aid.
Yes.
A crutch or to walk.
Some even sit in wheelchairs.
Yes, and then eventually people don't have a lot of time of yours. They just come here and say, give me a wheelchair for my jaja. And the wheelchair becomes cause for more disability. It's that the muscles you can't stretch out the.
Global Logistics Limited, your number one customs stealing and forwarding cargo consolidation warehouse company. We do air shipment, worldwide sea shipment, transportation, tax consultation. Love it? Logistics Limited is a competent company specializing in logistics, scaling and forwarding services. We have the necessary skills and resources and partnerships to tackle sizable projects to our clients' satisfaction. We are located at Mganzaraza Plaza near the entrance of Katwe, Kampala, Uganda. Call us on +256 779 634 328 or +256 701 784 648 or visit our website glovylogistics.com or write to johnglovy@gmail.com. Glovy Logistics Limited, your number one clearing and forwarding company.
Joints. You can't stretch out the legs, the muscle of your hip is contracted, and then you become disabled. And that's where you get complications. They say he died of old age.
Okay. So in your medical career, could you tell us some of these cases that you've ever worked on, experienced, and how you tackled them?
Yeah, I've traveled to a number of countries for orthotics and prosthetics and other orthopedic disorders. Here, if you look at, for example, if I give you a CTVE, a congenital equinovarus foot which is Kabi, people say judge of the judge seem to be like that. And yet it is treatable, it is manageable in its infancy. This child is big, quickly born. If he's born and they come, I start to manipulate and I can correct that deformity. But there are other surgical conditions, there are other surgical deformities, which actually you need an orthopedic surgeon to come in and releases the tissues, soft tissues, either the skin, either the ligaments, or the tendons, and then you can keep it right. But we have different types of braces that we use. Somebody can walk with it, and it is corrected. So those some of them I call them poor man's diseases.
Poor man's diseases.
Or poor man's disorders.
But the other time told me it is rich man's disease.
The rich man's diseases are different from poor man's diseases.
Okay, first tell us the poor man's disease.
Yes. So poor man's diseases say Koja was saying of the what. That is ours. That's how we identify our child. If he has got that deformity, somebody comes with the club foot and say, even the judges was like that.
Yes.
Until this man goes to read or to study and he says, this thing can be corrected. Then look at the Nkobogo. What is Nkobogo? Gen balgam or gen balas, knock knees or bowing leg.
I've seen them.
That is our family disorder, and they grow with that. Until you reach skeletal maturity, that is start to find the difficulties or pains in the joints, the back, the hips, the ankles, the knees. And then this is when they come to you say, so this place is pain, and you look at it, disorganization of the spine. Somebody develops a scoliosis or develops a gibbous deformity, and things like that. But we have a lot of our traditional beliefs that our child in our family, in our clan, to see that is ours, must have a Nkobogo, must have a bowing leg. So you need to teach them, you need to convince them that it is treatable. It's a disorder, it's a ligamentous disorder, or it is a bone disorder, or it is skin disorder.
Yes.
It is treatable. And
I used to see those kids.
Because that's That's our symbol. That's where our family is going. And you get better food there.
Yeah.
So, but we find it, we have been extending our orthopedic management to a field, different places. And you receive a lot of patients actually who require surgery, others require conservative management, others actually rehabilitating. There is nothing you can do. The deformity that occurred, need to rehabilitate. Give braces or orthosis, or give crutches, give other spinal disorders. We give them braces. We give them corsets, spinal braces to hold, because it comes with the pain. Say, hey, cutting black here and there, and have pain. So you just brace that one control, and there's nothing you can do with it.
Well, when I visited you last time, you told me about our military UPD officers that you treated. I think they were in war. What happened?
Those ones actually the Department of Medics sent me. Uh, they sent John ambulance to teach them emergencies. How do you handle a patient? Some of them are not a number of them in different parts, and they have benefited. Somebody gets you get an accident, a full truck gets an accident, and you just handle these patients because the 2020 of best course. They think the hospital is going to do something. Somebody has got a spinal injury and is bolted in a PW car to drive him to the hospital. Reaching there, the cord is already injured and this person is paralytic. You will never walk again. But they think we have reached very fast, we have driven very fast.
The power of memories has never been so meaningful than when time passes by. It's only in photography and videography that we can be able to tell what exactly happened in our lives. Do not lose the beautiful events of your life, from graduation to birthday parties, introduction ceremonies, parties that matter, wedding. All this and much more can be brought down into memories of photography and videography. At KEB International Group, we understand what it means to keep these memories. We are inviting you today to contact us for the best rates in town for your photography and videography events. Plus 256 702 1375 66 or plus 256 773 1375 66. We will cover and reach you at any time, any part of the world. No matter the time, we are here to keep your memories alive. Keep videography and photography your number one events memories.
Yet it would have been handled on the site to save his paralysis. So I was teaching them bullets, gunshots, bomb blasts, approaching. Those are things that have been teach to them, and they are doing well. Our surgeons in the police, in the army, they are doing good work. I've taught a number of police officers, especially the traffic.
Yeah, the traffic, because someone gets an accident and border is knocked in, they just put him in there.
And then they call the police. The 99 comes in and say, there are those who sit in the patrol vehicle. Then they put the client under the tables, and then they can.
I was imagining the pain because already have an accident, and now
by the time he brings you to the casualty office, I say, thank you for bringing the patient, but already the condition has been worsened. by transportation only. That distance,
Transportation
yeah.
only.
Even when you are transporting from Wandegea to Mulago, that's enough to destroy the cord. That's enough to complicate a leg circulatory disorder. You know, we had one surgical camp which was sponsored by a British, which I've painted that
Zebra
Valley
crossing?
zebra crossing myself. Some of you have
Ah,
seen the very, and it was our week, St. John week, and I painted that, and we
wow.
demonstrated.
Thank you.
And the British High Commission said, how 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 best can we do? And I think that's a government business. I think they can, I know it's fine. But I've demonstrated, and Edward Clay was the British High Commissioner here, and he came to officiate, and he was appreciative and say, I think for you in Uganda, you are covered. If you have such a yeah, several. I've moved to the industries. I've moved to schools in the north. I've moved to the south. I've been close to Rwanda.
Even to Rwanda?
Yes, because they had an emergency. They had the shell company they established. Safety. Safety. And the people working there, how to then you could find they see chukumi, having fireplaces to roast the fish and what, and they're nearby the gantry. So I think I've set up that one. Told some of the late Professor Kakande who was there. I said, no, I bring somebody who will do it for us. And I've done it virtually. I'm happy if I go there and I'm seeing the safety officer is telling me. People are conscious about safety. Uh,
During Chogam 2007, we saw you being recognized by the Queen of England, Queen Elizabeth.
oh,
What
yes.
was the award about?
That award is given to somebody who is a volunteer. They call him serving brother of the Commonwealth.
Okay.
And they have put me on medals that actually when I move as
so powerful.
yes, because somebody who renders his life to others without expecting a pay, that is very, very important. And the different disciplines, I've not even exercised it on my village. If you have traveled on Masaka Road, a place called Insanji.
Sanj, yes.
Yes, if you look at those 12, there are 13 humps. It is me who initiated with the late Dr. Chiseka.
Oh, the former vice president.
Yes, so it is me who has put those things because people there said, hey, my friend, that corner, don't joke. Every month he has to sacrifice so many. Every week he has sacrificed many. Then I told them, okay, let's try to convince him that people should not die like that. And I elected those 12 amps. And if you look in Uganda, I think those are many amps compared to other places. And we are successful because when you look at the accident occurring on Masaka Road, Insanja has been eliminated. But before that was an accident-prone area.
Exactly.
Where everybody say, have you passed Insanja? Yes, you have reached Masaka. Have you passed Insanja? Yes, you have reached Kampala. So it is me, the small boy, who was managing.
Thank you so much. People thought they were those by judges sacrificing.
Yes. Yes.
And then the students that you are medical students who are teaching all over different countries. How is that program conducted?
Sometimes donors can inject in coins to run it because those courses are a bit expensive.
They're expensive.
And very few people will put an eye and say this is important. somebody wants to buy to stock up his company, then you tell, let's teach your workers about safety. Say, that's not, when they are sick, you take them to the hospital. And they wouldn't think of sensitizing them about safety of their own, because once you are taught a first aid training, management, emergencies and first aid management, they are training your home, people on the road, and the place of your work. But people don't take it as a point. Say, there's a hospital. When he gets sick, it's a hospital. When he puts a bean in the nose, you take to the hospital. And some of these don't reach the hospital, but they die on the way. Bleeding, asphyxia, blockage of breathing, they die. And then you reach the hospital, the doctor tells you, I wish you had done first aid to this person, child, or whatever. And that's where we get a problem, actually, in Uganda.
I can see some items here.
Well,
what are they about? If the camera person can show them.
These are just orthopedic tools.
The other one is so heavy, it's like for Masezi to eat.
Yeah, this is the handling a task. When you are moving somewhere.
Must be painful to be exposed to the human body.
Yes, you remove the cast off with that. And, you have protected the board and you have put it in alignment to grow. You have produced a new board, colors formation. That area is strong. You need to put a strong cast so that the 3 stages of bone healing will
ffe bakimbowa concrete products nga tusangibwa wano Nakawuka Mpumudde, nga tukola buli concrete work yenna abeetaaze pavers ez'omulembe, pole bricks, mu size zonna tulinako inch 4, inch 5, inch 6 ne inch 8. Wano Nakawuka Mpumudde okunana ne Health Center 3, era nga products zaffe ziri ku miwendo emirungi ddala tuzitunda okusinziira mu mitendera. Inch 4 ina price yayo ennungi, ne inch 5, ne inch 6, ne inch 8. Osobola tufuna ku masimu gaffe wano wammanga 075 25 87 48 n'endala era nayo Airtel 0703 98 66 84.
Because once the bone breaks, the first stage of injury is the skin.
Injury is the skin.
Because you have to get the skin. Then it goes down to the fascia. It goes down to the bone. And if you look at the stages of bone healing, are very crucial. But this is where our local bone setters mess up. And they start to massage. So
those people are using.
People think they can know. Bones, doctors put them that there's no infection. Set alignment is fine. Alignment is okay. And they see the cast. They say, come after 8 weeks, come after 1 month, come. Then they review. And the bone treated or non-treated, it will heal. You don't treat the bone of the dog. Dog breaks the leg.
Yes.
It hangs in space. And with time, it does some testing to see whether it's firm. You are not the one treating. Even your bone, once it breaks, the doctors will put certain misalignment and then infection. But then they say, okay, put your cast, and then they say, shall meet. Come after 8 weeks, I'll check, and the bone colors formation will form. And people think that when you spit a lot of saliva, then the bone will heal. And then they start to disorganize the new bone forming. Eh? Eh?
Wow.
But as I said, if bone treated or non-treated, it will heal. Because callus is in you. The osteocytes and the osteoblasts, their job, the cells that are forming.
But I hear our young men, I hear so many cases of border borders and Lago hospitals spending their month and month being treated.
They spend a lot of because you don't get first-hand injury.
Eh.
They have either tried some local bone setters somewhere, try it, or the methods of transporting these people from the incident site to the hospital. That is very crucial. As fast as you reach the hospital, you will see the doctors looking at that. Somebody doesn't know how the bone is broken. You will just say, let us you bring, let's massage. And then when they see the conditions are worsening, this is when they say, there's a wound, if there's anything, they complicate. So the best thing is, I've trained about 700 vehicle borders in Kawempe.
Oh, thank you so much.
And if you want to travel on a safe border, it is from Kawempe division, because I trained over 700. The British High Commissioner and the St. John Ambulance sponsored me a training, and I had even to bring them to the hospital, the sites,
Wow.
to look at what the borders are doing.
It's terrible.
Very
People are
bad,
dying
yes,
on borders.
And now when you go to that site, at least people are organized. But here they seal off, somebody is injured, and then they say, hey, they lift and bang the patient on a vehicle, and this is where they cause the disorders.
So you retired from the Mulago National Hospital and you are a private consultant. Could you please tell us about your facilities and those watching, if they are free to come and get consultancy?
Yeah,
and
definitely.
What kind
I'm
of
still in orthopedic technology. I'm still patients are referred when they reach the consultants or the professors. They always refer those patients who require orthotic management or prosthetic management or rehabilitative or traumatic. They always refer them and say, please. But if they call me to give a talk, I usually go and give them a talk in the training school. This and that. They tell us we don't retire.
Yes.
You don't become tired. It's continuity. Yes. Even if you can't stand, they always bring a chair and say, advise us on this. And then you say that. I've done some work. Yes. So some of these things people are not informed. And you see the government has got a lot of work. They look at those as tiny things. The individual companies, especially the British companies or the embassy, will always say, let's sponsor this in this discipline. You go and teach the workers. There are some companies which are champions. Some of them are very like a night with ginger. What? They could call you, say, give us 3 weeks of training for our workers. You camp there, you train them, and they have got out a very good yield. The profit margin was okay because people can know how to prevent injuries, how to manage injuries, and how to transport those who are injured. That is very important, and it doesn't become costly to these companies.
Doctor, I know you give us more opportunity to get to learn more. This is just the beginning.
Yes.
But as we prepare to wind up, I saw some pictures in your house with the Kabaka of Uganda. Could you please tell us about that side of the royal family?
Yeah, I'm from the royal family, and it is my duty to look at that the people, the people are well catered for. Yeah, I think we have never had a biggest gathering like that along the coronation period.
Was it 1993, 1994?
1994, I think.
Hmm.
If I'm not mistaken. And you know, we're just establishing a kingdom, we're starting a society, we don't have money, but we need the people safe. So I was requested, Kabaka doesn't request, I was instructed. Yasima. Now, please come and teach my people. So I trained emergency medical technicians over 80, and we gathered them from different corners, from different hospitals, and we collected at Nsangi, and we trained those emergency incidents management team, which will handle the coronation and the burial ceremony, and during the coronation, I think you look at the pictures, and I did some work. I wouldn't know, because when you have done a work to their king, you wouldn't even say I've done some work. I don't know. But on coronation site at King's College at Budo, by the way, that's where I used to fear, because remember the army had left.
Yes.
The bomb blasts, the bombs are there, the reptiles, scorpions, millipedes, centipedes, and the broken bottles, and people wanted to clear the palace to start working. So I was a soft officer who trained and who gathered the bomb squad, bomb blast squad, and then I trained people how to handle if it occurs.
Of all the strength that your sweat goes in every single moment that you wake up early in the morning, go to sleep, bed late, you want to have a beautiful home. Acquiring a beautiful home makes your dreams come true. We at Cape International Group are proud to extend our deepest in strength, expertise and team to make your home beautiful. We do stone building and carving on all the nature of buildings that you would like to hold. Stones make a home so beautiful that you cannot underestimate the beauty of stones. From every perfect stone, every carve and every crafting, we do and we achieve this. At Cape International Group, we don't only do that, we also paint your homes. Every nature of paint that you would love to make your home beautiful is available at Cape International Group. A well-dedicated team is here to make it happen for you. Contact us today so we can make your home the most beautiful and secure of all at friendly prices. That is what we are promising you, with a lot of dedication and sincerity, honesty, and every category that you want to achieve. This is what we are talking about. Cape International Group, your number one partner to make a beautiful home for you with great services of painting and stone. This is what we are. Call us today on +256 773 1375 66.
If a blast was left somewhere and it injures people, what can you do? How do you transport? And the hospitals around Baga, Mengo, Buli gave me some ambulances and some manpower. So I handled it. And I was very happy actually not to receive injuries that I expected.
Wow.
But then I continued to train the people preparing for coordination. And I hope, people who have visited those countries who keep records can always find my pictures struggling to teach. Go to the schools around, go to the villages, and the whole place was safe. The coordination side at Queen's College at Bodo, down. I trained the number of people. If this happens, what do you do? How do you shout for help? How do I transport the patient if you don't have the ambulance? What injuries can you expect here? And they did a wonderful work, which I hope made us survive, not to have injuries.
Is there anything else that you'd like to say on our show as we wind up, Doctor?
Yes. Thank you. Thank you for interviewing me and having my biography and having you showed interest. Look at what can we do to the people, can do to our country, educate them. You know, the biggest problem is that trauma or accidents don't have appointment.
Yeah, true.
And it doesn't have a creed, it doesn't have a community that those traumas, those injuries supposed to be in this community. So it's a collective effort that everybody must learn about it. I'm so happy that you fished me out and have my talk on trauma and accident management. So, but you got an organized company or gathering, you can always call me. My email is on. Give me a shout. Say, give us a talk about bands. These people are Fumba what? Walaji.
Yes.
And this dust can get the village. So come and give us a talk. I'm ready to do that.
It's been a pleasure to talk to you, Dr. Mutebi Isaac Lukanga, who's a senior medical specialist in bones and much more. Just heard from his office at Teacher's House on Bomba Road, Kampala, Uganda. And we would love to have this conversation continue. You can always reach him for more and more information. The numbers are on the screen, as you can see. Thank you all our viewers. Keep subscribing on our website hicnewsagency.com, on YouTube and all our social media. Apart from this show is brought to you by Keb International Group in partnership with Heal the Planet Global Organization in special consultative status with the United Nations. My name is Chivumbi Ernest Benjamin, the honorary doctorate degree, and on the camera has been said Barbara Rahina. Until next time.
The Senior Citizens Talk is brought to you by Africa at Heart, Heal the Planet Global Organization, HICGI News Agency. Subscribe right now to get our latest updates sent every single Sunday. Don't forget also the Talk to the World show that is running every Thursday at 4 p.m. Subscribe here on YouTube and make your notification bell right here. HICGI News Agency. Visit us on HICGINewsagency.com and find us on all social media platforms on X, call it Twitter, on TikTok, Instagram, and Facebook. HICGI News Agency. Subscribe now.